Hi, this is Stephen, and in this video we will discuss how to use echo to analyze a leaking aortic valve or aortic regurgitation. And so if we were to look at our aortic root here, leak in the aortic valve can be due to problems in, as we've talked about, the door frame or the door itself. So in terms of the door frame, if your aorta is dilating or if it's inflamed or if there's trauma, any of these things can cause a regurgitant jet down there. And in terms of the door itself or the valve leaflets, you could have a perforation in which blood will go straight through a hole. You could have flail where the leaflet actually ends like that, in which case you'll see a jet of regurgitation away, pointing away from the leaflet that is flail. Or you can just have a degenerative valve where maybe it's from rheumatic heart disease, maybe it's from calcific disease, where you just have a jet coming down the middle. But again, these are all problems with the door or the valve leaflets, whereas this other class would be problems of the door frame. All right, so we can get a better look at this in our parasternal long view. So we've got our left atrium that empties into our left ventricle. We've got the aortic valve right here that's supposed to be closed, but it's leaking. And our RV up here. And so we've got a jet of blood. You may see a little zone of convergence here. You'll see it come to its narrowest point, maybe just somewhere right down there. And then you'll see a jet of regurgitation. And as we've talked about in other regurgitation videos, it can be tempting to just look at how large the regurgitant jet is in the left ventricle, but we have to be careful since our machine settings can make us over or underestimate this, and if it's an eccentric jet, then we can be misled. But there is some value in looking at how large the jet is in comparison with the LVOT diameter, certainly. But what are some techniques that we can use to quantify the leak? Well, as we talked about in a previous video, we can use PISA. And actually, first let me mark out here mild versus moderate versus severe. And we talked about how you can use the proximal isovelocity surface area method. And if you see that it is less than 0.1 centimeters squared, that would be mild, versus if you see, let's clean that up a bit, less than 0.1 centimeters squared would be mild, versus if it is more than 0.3 centimeters squared of a leaking area, that would be severe. Got your regurgitant fraction and your regurgitant volume. That's the volume of blood that is leaking backwards. If it's less than 30 milliliters, that's not too bad, but if it's more than 60 milliliters, that is considered severe. The regurgitant fraction, the fraction of blood that is flowing backwards, if it is 50%, just like for the mitral valve, that is considered severe. In other words, of all the blood that goes out the aortic valve, if half of it is coming backwards, that's a problem. That's severe. And then we've got our vena contracta width. And that is just that's the width at the narrowest point of the jet, right about there, let's say, which is a quick estimate of what the leaking area is. If you were to say that that's the diameter, so you take half of that, pi times the radius squared, that will give you a number close to your PISA area. So if it's less than 0.3 centimeters, that would be mild, versus if it is more than 0.6 centimeters, that would be severe. So these are some tools we can use. A couple other points to keep in mind. if you see that there is a flail, leaflet, that typically goes with severe. If you see that the left ventricle is dilating, that would also typically go along with a severe jet. And there's one other concept that I want to talk about that we can get from our apical 4-chamber view. So here's the left atrium. It empties into the left ventricle, and we tipped our probe, so we've got the so-called 5-chamber view with the LVOT and aortic valve, and then our right atrium, right ventricle off to the side. And we're going to use our continuous wave Doppler to measure the flow here. Now, what will we see if there is? I'm going to draw two different graphs. I'm going to draw one for mild and one for severe. So with mild aortic insufficiency, you'll see something like this. You'll see something like that. That's the blood leaking backwards, and then you'll see the blood going out of the aortic valve as it should, and then here again you'll see blood leaking backwards and normal forward flow. This would be considered a mild leak, and I'll just lightly shade this in here. Now severe leak, on the other hand, would look like this. You'll see steep downward, very bright. And then over here you've got your normal flow, and then here again you've got your steep downward and normal flow. And I'm just going to shade in the normal flow as well, because you should have plenty of blood flowing out. Normal flow. There's two things that we can gather from this. One, I've tried to show kind of a light shading with the mild versus in the severe. I've tried to shade that in more, and basically the brighter the trace looks, that corresponds to more blood cells that are involved. And so if this is very bright, this regurgitant flow is very bright, that means there's a lot of red blood cells leaking back. That suggests severe regurgitation. But the other piece that we can get from this is we can look at the slope. This is similar to your pressure half-time concept with mitral valve. What you can do, so basically but it's the opposite. So the flatter the better. And why? Why do we have, with mild regurgitation, persistent ongoing velocity? Well, the persistent velocity between the aortic outflow and between the left ventricle, persistent velocity here, means that there is somewhat of a barrier to flow here, and that's why you have this barrier. That means that there's a decent gradient, and you have flow. You have a trickle of flow that keeps going backwards for a while, right? That's why this line is flat here. However, if, on the other hand, I'm going to redraw this a little bit. If, on the other hand, I have a large leak, and I can have all the blood dump back at once, because there's really not much of a pressure gradient or much of a restriction to flow back, you'll see plenty of flow early on, and then the pressures will equalize, and I will not have flow. So having a very flat line means that there's a persistent gradient and persistent trickle of flow, which is a good thing when we're talking about a regurgitant valve. So the flatter that line, the more likely you have mild aortic insufficiency. And if it's steep, and if it's very bright, the tracing itself is very bright, but if it's steep, that means you have rapid equalization of pressures, because you have lots of blood leaking back all of a sudden from the aorta back into the left ventricle.